you bring over 25 years of healthcare industry and public sector transformation experience. You are the global co-lead for KPMG's Connected Enterprise for Health and lead their digital health transformation practice in Canada. Now, when and how did you discover your passion for digital health and innovation in healthcare?
There are lots of opportunities when I fell in love with digital health, but one of the things that I'll go back to was when I first started at University Health Network many years ago. We were developing a small portal solution that would allow physicians at the Princess Margaret, who were also cross-appointed at the Mount Sinai Hospital, which is a separate organization from UHN. Those two sites were essentially where care was being provided for cancer patients. The problem was we had physicians who were cross-appointed at both of those hospital locations. So they're treating the same patient, but they had to use two separate solutions in order to get a hold of the patient information that they needed to drive decision-making, right? And so we were creating a solution that would actually bridge the two solutions that would present the information to the clinicians. And so they had all of the historical data in one place. They didn't have to go bouncing back and forth between the two systems. When we put that solution in place, and interestingly, Bob Bell, who became the CEO later, was our user number one for the solution. It wasn't so much that the technical part of it was all that impressive or sophisticated, but what really stuck out for me was that he said, by creating this solution, you've actually improved not only my ability to treat my patients better at both sites, but same patient, but you've also made the condition better for the patient because they don't have to repeat everything that they, talk about with the two separate teams, right? So he said it was a small thing to do, but a massive impact. And I just thought, that was a small project back in the day, but it had a huge impact on patient care. And anyway, so I just thought wow, if we can do something, that massive, have that important of an impact with a relatively small digital enhancement, why can't we do more? So anyway, that was a great example of what got me really excited about this.
And how far along have we come?
Oh my gosh. Well, this was before sort of sophisticated electronic, health record systems were in place, before really using clinical decision support to advance decision making. So I think we've come a long way. One of the problems we still have is that people have multiple systems and they're not always, super connected. So that is still a challenge, but basically the clinical records that needed to be in place back then are now in place. And so even at the community level, more so. So not just in the hospital. So I do think we've made a lot of progress.
So we've made a lot of progress in terms of the integration and the patient experience, but we still have a long way to go.
I think so. There's still more work to do. We're not finished.
What's the vision you have of a truly integrated system?
Well, a truly integrated, IT system really needs to support a truly integrated health system, right? So if we think about Ontario, what we're trying to do with Ontario Health Teams is to really be able to support a patient through their entire journey across the entire continuum of care in every care setting. And so, until the information systems are actually allowing clinicians or caregivers the opportunity to share information across all of those multiple care settings about a particular patient, we haven't quite, achieved what we wanted to achieve.
In the healthcare system, there's so many different players and so many different funding sources and who takes responsibility, who is accountable. How do you work through all of this to really develop an integrated, healthcare system and health technology system?
It's a great question. I was just at the HIMSS conference in Orlando a couple of weeks ago. And one of the things that really struck me was that while there are some really interesting and innovative solutions to help bridge the gap between the different care settings, the problem is, a lot of these vendors are we just can't move this stuff. Nobody's buying it. And one of the things that kind of dawned on me was that the people who have the budgets, which are typically the larger institutional providers, aren't necessarily the parties where the benefit accrues to them from using these solutions, meaning that the care is really improved in the community setting when you can keep people out of hospital. But the community agencies have the smallest budgets, right? And we haven't yet, at least completely in this province, moved money around the care settings so that the people who are getting the value from the solution are able to also fund it. And so I think that's one of the challenges that we still have yet to close in this province. But I don't think it's just an Ontario phenomenon. I think this is something that that we're seeing elsewhere in other global jurisdictions. And so I'm hoping that, the OHT model is a way that we can actually sort of address that.
Yeah, hopefully, because it's such a great point and it's such an important one because, even through your work with KPMG, we see that only happens at obviously the hospital level or the bigger institutions. At the community level, we're not able to play with, those kinds of ideas or access that kind of talent.
Yeah. And even when even if you pool resources at the community level, it's still generally not enough to really fund these sort of system-wide projects, right? And so I think that it's not just a funding issue, but it's also a recognition that the value needs to accrue to the parties that are actually paying for stuff. So if that's actually spread across an integrated health system like an OHT, then everybody should be able to pay kind of their fair share. I'll say it that way. But I still think that we have a challenge in terms of the budgets just aren't sort of allocated that way.
Now, you did a powerful presentation on scaling and sustaining innovation in healthcare in 2019. And that's where you spoke about how the public sector does not think about change and sustainability in the same way as the private sector. In the public sector, there tends to be that focus on short-term benefits, our alignment with the political system over those longer-term gains, and that lack of business thinking. So how are we doing now that we're into 2022? We went through the pandemic. What advice can you give to leaders to help them start thinking a little differently about change and the future of healthcare?
I have to say that I think we're worse off because of the pandemic, and I'll explain what I mean. So before the pandemic, proof of concepts or pilots were small projects, tests of change in order to demonstrate that something made a difference, right? The real problem with sort of sustainment or operationalizing those types of proof of concepts is that we only thought about the costs, we only thought about the workflow associated to that proof of concept. And as we know, like when you try to embed a change into a broader context, you have to take those broader contexts into consideration. Otherwise, that thing is going to die, right? And so when people get busy and they get excited about the next change, then they kind of forget about the last one. And so that was one of the challenges before the pandemic. What we've seen during the last 2 years, I'll take virtual care, for instance. People had to implement virtual care very quickly because the hospitals were closed, clinics were closed, services were closed, right? They had to essentially slam in this new technology because they had to in a very short period of time. And the operational sustainment was like the last thing that they thought about when they were implementing virtual care during the time. And what we're seeing now is that while people want to maintain virtual care, they want to be able to provide a hybrid in-person and digital, set of channels to their patients. We're seeing that like people are struggling to pay for these things to keep them going. They're struggling to sort of make sure that when they are starting to bring patients back into the hospital or back into clinic, that they can actually manage both channels, right? And that they have appropriate channels depending on the patient circumstance. They haven't thought about how all of this is going to get embedded on a permanent basis. And so what we're seeing now is a lot of our clients are actually struggling with how to keep it going. And now it's on top of everything they were trying to do before the pandemic. I actually think it's tougher. It's even tougher now. And so there's going to have to be some tough choices that people will make about what to keep, what not to keep, and how to fund these things going forward. Because the COVID money that I know most healthcare organizations were able to get to offset those immediate costs is not going to last forever.
But you do see a future in virtual care?
100%. So what we see is that now with, having the experience of having virtual care, and look, most of virtual care was a telephone call, right? Let's not kid ourselves. However, I think it's fair to say that patients appreciated the flexibility. For people who have to come to a downtown hospital or a service downtown and pay $30 for parking, right? And then to essentially get 15 minutes worth of care is not a great experience. And so people really did find that the convenience for certain circumstances was warranted. And then providers were able to see a lot more patients in a much more effective way. So is it for everybody? No, of course not. But could it be for, a lot of patient cases? Yes, 100%. So And in fact, what's great is that if you look at Ontario Health and Ontario MD and other entities, like they're trying to come, and Canadian Medical Association for that matter, they're trying to come up with like guidelines, like clinical guidelines for appropriate use of digital channels. And I think that's exactly the next sort of step we need to take as a health system.